Well, hello, it's Bruce Williams again, and today I want to present the fifth lecture in my series on the selected gross pathology of small ruminants, in which we're going to talk about diseases of the respiratory system. But before I do that, I want to thank my friends and colleagues who over the years have provided me these fantastic images to choose from. Let's start with a non-specific picture of an animal with some perinasal ulceration, but most importantly, salivation. There are a number of diseases that can cause both lesions in the respiratory and GI tract. At the top of the list is Pestis du Petite Ruminant, something very much like rinderpest in cattle, which causes lung disease as well as ulceration through the GI tract. I'd also have to think of blue tongue, which can cause hemorrhage and ulceration around the nose and around the mouth, and this is actually a picture of blue tongue. Two other diseases I think you also have to consider, especially these days, are malignant catarrhal fever, which about 15 years ago we didn't consider much in sheep, but now we know that sheep are a major source of the infection for other species, and animals with a heavy viral load can develop ulcerative lesions in multiple organs themselves. And then finally, probably want to consider ovine pestivirus, which can cause ulceration in the GI tract of sheep. If we start in the upper respiratory tract, one of the diseases that you absolutely need to know about in sheep and to a lesser extent in goats is enzootic nasal tumor. This is caused by a retrovirus. Enzootic nasal tumor 1 causes the disease in sheep. Enzootic nasal tumor 2 causes the disease in goats. And it causes the formation of neoplasm from the glandular cells, either of the olfactory or the respiratory mucosa within the head. So you can see them pretty much anywhere within the head. They can be fleshy white tumors like this, or they can be hemorrhagic and be very dark. They can be covered by a layer of mucus. This one is fairly small, but as they grow larger, they can result in severe respiratory distress as well as deformation of the skull due to erosion of the bone. These tumors don't seem to, even though they're the result of a viral infection, they don't seem to engender any particular immune response. And they're thought to, or proven to, have been caused by beta retroviruses. There are a number of studies which have shown that they are transmissible, at least in sheep, in which young animals are infected. One study showed that in filtrates from the nasal cavity of animals with these tumors, when instilled into the nasal tract of 2-week-old lambs, a small percentage, usually 20% or less, will develop tumors as early as 14 weeks post-inoculation, and it usually takes a bit longer for them to grow to a size to cause all of the problems. But it is a transmissible condition that is caused by a type B retrovirus. There are certain parts of the world which do not have these tumors, including the United Kingdom and Australia and New Zealand. But there was a recent publication from Ireland in which an animal developed a very similar neoplasm. And it turned out that another closely related virus, which we're going to talk about when we get into the lung, the Yogsikhti Retrovirus, was cultivated from that particular tumor, and looks like, being so closely related, it may be a cause of a small number of these nasal tumors, and a cause for them in parts of the world where the enzootic nasal tumor virus has not been found. So very nice, large tumor in the nasal cavity. Of course, these animals are going to have a lot of trouble breathing. They will have continuous nasal discharge. As we said before, ultimately may end up with bony deformities of the face. Luckily, there aren't a whole lot of disease to talk about in the upper respiratory system, but when we talk about sheep and goats, we also need to talk about the nasal bot. The nasal bot is in sheep a larva of the sheep bot fly, Estrus ovis. The fly will lay its eggs in the mucus droplets at the outside of the sheep's nose, and then they will migrate up into the respiratory tract, into the nasal cavity, where they often come and locate themselves in the posterior portion and go through a series of migrations, and then become large larvae, which cause these animals a number of problems. They have to be incredibly uncomfortable. These animals will snort and stomp. They will bang their noses on the ground in order to try to dislodge them. And it can cause a problem with sheep production when a lot of animals are infected, because if you can't breathe very well, you're not going to eat very well, and you don't put on weight. At the end of the larval stage, these larvae will crawl back out of the nose, they will fall on the ground, and they will pupate and become an adult fly. The sheep bot adult does not eat during the during its lifespan. It simply mates and lays eggs. It has a very pronounced sound that sheep tend to pick up on. It has a very loud buzz, and so a lot of sheep, if they hear this, they will immediately put their noses on the ground, or a group of sheep may form a circle with their noses toward the center and down on the ground. Deer have a very similar parasite known as Cephanomyia. And for the most part, they're not considered significant contributors to ill thrift. However, they can cause a bacterial sinusitis. The problems, as we said, with breathing may lead the animals to be malnourished. And every once in a while, they will go on a bit of a walkabout. We see a couple here attached to the area by the cribriform plate, and if they're a little too aggressive, they may end up within the skull proper, resulting in a septic meningitis, something that is obviously a bad end for the animal. So as we move a little further down the respiratory tract, this is a condition, this form of necrotizing pharyngitis is something that we used to see a lot more when animals were fed boluses by or were wormed with mechanical apparatuses like metal balling guns or drenches, where it would be inserted in the mouth of the animal, and the materials would be pushed down the esophagus, and a lot of times you would get excoriations around the larynx and the pharynx. And as we've seen in lectures before, Fusobacterium necrophorum is a common commensal in the GI tract, just waiting to get into little cuts and crevices, which then heal and provide Fusobacterium the anaerobic environment with which it will proliferate and liberate necrotizing exotoxins, causing these necrotic lesions. Can we move down to the lungs? You bet we can. And here's another sort of non-specific lung picture that will start our tour in the lungs by making us think of a lot of possibilities. Okay, these lungs are very enlarged. They are very wet. And like the non-specific slide that I showed before, this is actually a severe case of blue tongue in this particular animal, blue tongue being an orbivirus, and orbiviruses in multiple species all like to infect endothelial cells, resulting in necrosis of the endothelium, thrombosis, hemorrhage, and edema. And so this animal had a very disseminated case of blue tongue, and what we're looking at is a severe congestion and edema associated with that. But I think that you would have to consider a number of other diseases, including Rift Valley fever, early shipping fever, heart water, which we're going to talk about in just a little bit, and maybe even clostridiosis, all agents that have the ability to either cause vascular necrosis or some outpouring of fluid into the lungs. Now, this is not the best picture of my collection, but it's very difficult to get good pictures of Pestis du Petite Ruminant. This, like so many of the other agents that are foreign to the U.S., comes to us over the years from Plum Island, which does most of the research and certainly a lot of the education on these particular agents. As we said before, Pestis du Petite Ruminant is a morbillivirus that is very close to rinderpest, and so the two diseases are very similar, rinderpest affecting cattle. And Pestis du Petite Ruminant is actually a more severe disease because of the mobility of the sheep and goats, and the fact that many more people in the world are reliant on small ruminants as a source of protein and food security than large animals. It is a disease that is just as important in rinderpest, and hopefully one day we will be able to eradicate this as well, because sheep and goats are much more mobile and people will drive them farther, and they'll actually put them in their vehicles and drive them around. It has a potential, it's even greater than rinderpest, for infection. As we said before, these are diseases that affect both the respiratory tract and the GI tract, causing necrosis and ulceration due to infection by epithelial cells in the GI tract. Pestis du Petite Ruminant is a disease that initially infects monocytes and macrophages, so it has the ability to get all over the body and infect a lot of different agents or a lot of different organs. In the respiratory tract, it causes a diffuse interstitial pneumonia. It belongs to the same family as canine distemper, so you have a diffuse interstitial pneumonia, and very characteristic is severe infection and collapse of the anteroventral lung. These macrophages, you'll find the viral antigen in many different cells, primarily type 1 pneumocytes and alveolar macrophages in the lung, and you have necrosis within the airways and a diffuse interstitial pneumonia. There may or may not be fibrin on the outside, and if you are seeing lesions also in the GI tract, ulceration of the upper GI tract and the lower GI tract, the colon and rectum, you may be dealing with Pestis du Petite Ruminant. There are other viruses that cause significant disease in sheep and goats, and if you are studying for a certification exam, these are very popular slides. Then there are two particular viruses that you need to be very familiar with, and you need to be able to differentiate. Hopefully I can give you some clues about how to differentiate the two. We're looking at the lung of a sheep, and this lung appears enlarged. It does not look like it is collapsing because this animal has a diffuse severe lymphocytic pneumonia as a result of infection by the lentivirus that causes a condition known as Mädi-Wiesner. It goes by many other names, including ovine progressive pneumonia, Marsh's progressive pneumonia, and ovine lentiviral associated pneumonia. This particular lentivirus in young animals can cause a demyelinating syndrome, resulting in severe neurologic defects, usually in animals less than 4 months of age. In older animals, it can affect a wide range of organs because the infected agents or the affected cells are macrophages. And once again, when you infect macrophages, you're trafficked all over the body. So this particular agent can cause lesions in the lung, it can cause lesions in the joints, and it can cause lesions in the mammary glands as well. When the lesion is in the brain, it's known as Wiesner. But when it's in the which is I believe Icelandic for wasting disease. When it's in the lung, it's known as Medi, which is Icelandic for shortness of breath, and a lot of the research has been done in Iceland on these particular agents. When we look at the lung, the interstitial pneumonia is characterized by a tremendous proliferation of lymphocytes within the lung, to the point where you get actual lymphoid follicle formation in some of these large aggregates. There are a lot of infected macrophages as well. Lymphocytes do not produce virus. Virus assembly is only completed in macrophages in this particular condition. But the activated virally infected macrophages result in a liberation of cytokines, which cause tremendous proliferation of T cells in the infected lung. This virus is very close to a similar virus which causes a similar set of diseases in goats, which goes by the name caprine arthritis encephalitis virus, which is good if you can't remember the different types of diseases that these cause. In sheep, it tends to primarily cause pulmonary diseases, but you can see a combination. The lesions associated with Medi and Wiesner are different strains of this virus, but they can, an animal can be co-infected and have both conditions going on. But the traditional Medi virus usually affects the lung, but may go to joints and the mammary gland as well. This is a cross-section through that lung showing you the sort of wetness and the consolidation and the failure to collapse of this affected lung. Here's a similar picture, but this is from a goat. This is the caprine arthritis encephalitis virus causing a diffuse lymphohistiocytic pneumonia in the lung. In goats, this virus, if we look at the number of reported cases, tends to cause joint problems most commonly, and we'll look at this when we get to musculoskeletal, with chronic infections resulting in hygromas, especially at the carpal joints in affected animals. But in the lung, it's a diffuse, proliferative, non-collapsing pneumonia, which under the microscope you'll be absolutely struck by the tremendous proliferation of lymphocytes. Now, if the lentivirus is one important virus within the lung, the other one is the Yogsikhti Retrovirus, a true retrovirus, which we have mentioned in passing with the opportunity or the ability to rarely cause tumors of the nasal tract. It is in the lungs where it really does its job. This is a classic picture of a sheep with tumors in its lungs, which are caused by the Yogsikhti retrovirus. I like these names because Yogsikhti actually means driving sickness, and The reason it got that name is that these animals are usually 2 or 3 or 4 years old. They've been infected probably since birth, and these lung tumors take a while to develop. These are the ones that when the animals would be driven to another field or would be driven to market are the ones that are lagging behind because they have these tumors and tremendous edema within their lungs, and they just can't keep up. And the old story is that if you take these animals at the end of these drives and you hold them up by their back legs, you can just watch the fluid pour out of their noses. And you can see that this animal is mildly underweight and is really having some trouble breathing here. And when you look at the lung of an animal that's been infected with the Yogsikhti Retrovirus, and I will say that sheep have the Yogsikhti Retrovirus is an endogenous retrovirus. These animals are born with these retroviruses in their DNA. Sheep have a tremendous amount of retroviral fragments within their DNA, and counts of 25 or 26, second only to mice, are in there. And these retroviral fragments are just waiting for the right opportunity to cause neoplasms as a result of damage to the DNA. And when they do, they will cause neoplasms in this species in the lung, or rarely in the nasal cavity. And I think that these are fairly characteristic and diagnostic on gross appearance. You have, to me, the pulmonary adenocarcinomas. These are neoplasms of cuboidal epithelium, generally from the bronchial alveolar rim. They form florid patterns of papillary proliferation, like lung tumors in many species. But grossly, they have the appearance to me of something like lymphoma. When you look at this cut section, it almost looks like this animal has lymphoma. This is a combination of the tumor itself and the tremendous edema that is associated with this. Remember, you pick these animals up and pour the edema out. When you take a picture of this and you put a cut section down, you have to keep picking it up and mopping under it because the fluid just exudes. The borders are often somewhat diffuse because of the edema, and it's contributing significantly to the opacity here. Surrounding these tumors are a tremendous number of alveolar macrophages, which are in there trying to mop up some of this edema. So grossly looks a little bit like lymphoma, if that is helpful to you in determining this from progressive pneumonia. It's circumscribed. The rest of the lung is not affected, whereas progressive pneumonia or lentiviral infection is a diffuse process. So focal versus diffuse, and then it has this lymphoma appearance. Here's another picture here of a pulmonary carcinoma, which is caused by the Yogsikhti retrovirus. I think these are very important viral diseases. They are not all of the viral diseases, and depending on the part of the world that you live in, there is at least one more viral disease that I want to mention that can be seen in the lung of affected animals. And here we have a lung that is affected by multiple nodules with a predisposition to be seen in the caudal lobes of the lung. This is not a good picture for pulmonary adenocarcinoma. It's not just one nodule or maybe two nodules. It's lots of nodules, and this is proliferation of the type 1 and type 2 pneumocytes. I often say that everybody has pictures of pox lesions, and we tend to, because there's so many pictures out there of cutaneous pox lesions, we tend to think of it as sort of a mild disease, but in certain species like sheep and goats, especially sheep pox is a serious life-threatening disease. The diseases are not they are not confined simply to the skin, but you will see them on the skin of animals. You see them throughout the body. And so the really bad pox lesions like sheep and goat and camel pox and smallpox are life-threatening because they affect epithelium throughout the body. Yes, you will see typical pox lesions on the lightly haired areas of this animal's body, but it is the lesions in the lung and in the kidneys, these nodules of proliferating epithelial cells. In the lung, you also have proliferation of bronchiolar epithelium, which results in inflammation and can clog small airways. So it's a life-threatening condition. In the kidneys, you'll have sort of fleshy nodules arising from tubular epithelium. The lesions are often seen predominantly in the caudal lung lobes. These look a little bit more like the traditional pock that you would see, with the proliferating epithelium on the outside, and then the older part of the lesion. These cells have succumbed to the cytopathic effect of the pox lesion, so we have necrosis. This one more just like the fleshy nodules without a lot of necrosis. This one has the necrosis. If this was, I guess I have another rule out for a picture like this, and I would think about mycotic pneumonias. But obviously, if you're looking, you're not going to be considering that if these animals have pock lesions in other parts of the body. This probably should have been put in the GI lecture. I don't know why I have it here, but similar pox, P-O-C-K-S, in the epithelial lining of the esophagus. So in sheep and goats, these pox viruses are truly systemic and truly life-threatening. Okay. I want to move on to the bacterial agents that we see in the respiratory tract of small ruminants. And if you've looked at my lectures on cattle or the lectures on the respiratory system, you know that I will lump 6 different diseases as causes of quote-unquote shipping fever in cattle. A diffuse fibrinosuppurative and necrotizing bronchopneumonia, or pleuropneumonia as the case may be. This would be a great case if it was either a cow or a sheep or a goat. It's still a great case of shipping fever. We have large areas of affected lung, and then on the surface of the lung we have a lot of fibrin. Shipping fever has a shorter rule-out list in small ruminants. We can take a couple of the ones we associate with cattle off of it. It still is predominated by bacteria who all are members of the Pasturulaceae family. These have been renamed over the years. The only one that still really retains the name Pasturella is Pasturella multacida. But Mannheimia hemolytica is an important player here. That one used to be Pasturella hemolytica. Bibersteinia triolosi, which used to be Pasturella triolosi, is also a much bigger player in small ruminants, and we'll talk a little bit about that going forward, than it is in cattle. And when we think about the others, Histophilus somni really is not much of a player. And we can throw out Mycoplasma bovis. And Mycoplasma is probably, there are a couple of mycoplasmas of note, ovi pneumoniae in sheep, and Mycoplasma mycoides large colony, or Mycoplasma variant capri, which both can cause considerable problems in goats. But the list is a little shorter. And manhymiosis in small ruminants really is not terribly different than it is in cattle. So I'm not going to spend a whole lot of time. You would expect very much of a similar gross appearance as we see here. If you ever know suffered of pleural pneumonia, you may have areas in which the leukocytic exotoxins and the endotoxin of the Pasturellas combine to cause necrosis and streaming of cell nuclei which resemble the quote-unquote oat cells, or actually areas of infarction in the lung. It's an ugly lung because the Pasturelaceae were laden down at the beginning of time with some really potent exotoxins. So shipping fever in small ruminants due to manhymia is probably very similar, often started off by a viral infection, parainfluenza, or something along those lines. Here is another case of shipping fever, and it reminds me to mention Bibberstenia triolosi. Occasionally seen in shipping fever in cattle, and is a little bit more common in certain areas of the world. It can cause up to 5 or 10% mortality in previously healthy lambs. There are lung lesions in these animals, but they're often found dead with hemorrhages in multiple areas, in the subcutis of the neck and the thorax, in the fascia of the muscles, and within the pleura and the epicardium, as well as the mesentery. There are often GI ulcers, and just something to be aware of in certain parts of the world. This could also be, if it was a goat, this could be, as I said before, Mycoplasma mycoides, mycoides variant capri, which can cause up to 60% mortality, with tremendous lesions in the lung, as well as a certain percentage of the animals having a more chronic infection resulting in joint infections. Mycoplasma likes to cause joint infections as well. So we will discuss those when we get down to the musculoskeletal system. And this final picture of these type of lesions in sheep remind me to mention the wide spectrum of agents that contribute to enzootic pneumonias. In certain parts of the world, enzootic pneumonia covers a wide spectrum of agents. In Australia, the list is very long, including Mycoplasma pneumonia. This particular picture, to me, resembles enzootic pneumonia in most species, well demarcated areas of inflammation and atelectasis in the cranioventral lungs. Mycoplasma will cause this particular lesion in pigs as well, with Mycoplasma pneumoniae. Ovopneumoniae in sheep can cause a range of disease from mild to severe. It also can be transferred to wild sheep and is a major cause of pneumonia in wild sheep, bighorn sheep, and various forms of non-domesticated small ruminants in the U.S. Other agents that are occasionally identified in enzootic pneumonia would be Pasteurella multocida, chlamydia, a variety of viruses, including parainfluenza 3, and several different types of bovine adenoviruses. Bordetella peripertussis, and then you get out into the weeds with some of these, including Actinobacillus lignarisi, various gram-negatives, and Histophilus ovis. So it's a wide-ranging group of agents that will cause pneumonia, chronic enzootic pneumonias in sheep herds, rather than the flagrant shipping fever, which we have discussed. Here's an old friend. We've seen it in almost every lecture. It's a real problem in sheep, and this is Corynebacterium pseudotuberculosis. As we've said many times, 20% of animals with the skin infection end up with systemic infections, the so-called thin U syndrome, and can result in abscesses throughout the lymph nodes and the viscera of the body. Here's very typical walled-off abscesses. Look at that fibrous capsule. And you can see the onion skinning or lamellation that's associated with Corynebacterium pseudotuberculosis in sheep. Not so much in goats, where it's more of an ooey-gooey center, but in sheep, it's a process of walling off the agent, but they can't break it down. Then it breaks through that fibrous connective tissue, and it puts down more fibrous connective tissue. And it breaks through again, and if this animal had survived, eventually would have broken through, and then the abscess continues to grow in this lamellar deposition of fibrous connective tissue. This is a visceral abscess. Animals can actually asphyxiate if they have these large, caseating, hard abscesses in the hilar lymph nodes. Okay, here's an agent that is not currently present in the United States, but lives right off to the south of us in a number of the islands in the Caribbean. So we have to be very careful. This is Herlinkia Ruminantium. It used to be Cowdria Ruminantium. I like Cowdria because it reminded me as a vet student that it's most often seen in cattle. But now it's Herlinkia Ruminantium, which is a tick-borne disease. It's carried by a number of amblyoma ticks, which are present in Africa, where this agent hails from. It was transferred to the Caribbean back in the 1700s and 1800s, and it continually lives off our southeastern shore. We do have ticks that can transmit the disease, so it's a disease that we always have to be currently mindful of. It's something that we do not see. It is Herlinkia is an intracellular gram-negative Coccobacterium, which can affect a wide range of ruminants, including small ruminants, cattle, antelope, and buffalo. Most common in sub-Saharan Africa, but now we see it in the Caribbean as well. The particular disease used to go by the name, and probably still does, of heart water, because of the tremendous effusions that infection causes. Effusions into the pericardial sac, from which it gets its name, heart water, and also into the pleural cavity. This light yellow sort of transudate often clots quickly on exposure to air. There aren't significant changes in the infected endothelial cells. So the tremendous outpouring of fluid into these potential spaces and also into the lung itself. There's often pulmonary edema, can be severe associated with this. But the actual cause of this is not well known. The endothelial cells appear normal, but they just let all the fluid out of the vessels into critical areas. So Cowdria ruminantium, Herlinkia ruminantium, heart water disease, something to keep in mind. Here's a good picture, and I think it explains the pathogenesis of aspiration pneumonia very well in multiple species. If you look at this, and I hope that you look carefully at this, you look at it and say, this is a funny picture, because this is a sheep, and the cranioventral lung is apparently normal, and the caudal lobe of the lung appears atelectatic, and that's opposite and counterintuitive of what you would think. And this is a case of aspiration pneumonia. And when we used to drench sheep or treat them for parasites, if you've ever done it, you take the sheep and you're standing there and you turn him and you sit him on his behind with his forelegs out, and then you do the manipulation and you get the drenching gun in there and you push the wormer. And this was even before paste warmers. This was usually a liquid. And if you got it in the wrong hole and it went down in the trachea, okay, because the animal is sitting on his behind, the material would go to the lowest part of the lungs. If you drench an animal on all four legs, it goes in and then it drops down the cranioventral. But if they're sitting on their behind, or the animal is a biped, like humans or like non-human primates, aspiration pneumonias tend to affect the caudal lobe, just the way the animal is positioned. If you are gavaging pigs or something in a gavage chair and you have the animal sitting on its haunches, you'll get the same effect. So when you see aspiration pneumonia in sheep, it is often the result of the placement of the animal during the drenching. I hope that's a good explanation for that. Just a non-specific infection with a range of gram-negatives. These are pulmonary abscesses from a sheep that had been attacked by dogs. The cutaneous wounds became infected. The bacterium had the option to the ability to get into the blood supply. It looks a little bit like those dark pox lesions that I showed you, but here it is diffusely over all lobes of the lung rather than concentrated in the caudal dorsal. So this was gram-negative pulmonary abscesses due to gangrenous dermatitis and in a dog attacked. Here's a great picture by John King of a very large abscess in the mid to caudal lobes of the lung. This probably was another inhalation pneumonia, which eventually abscessed out. The other thing that you want to consider when you see a huge abscess like this is always run the pus through something like this, through a strainer or a bit of cheesecloth. Don't just wash it down the table and down the drain, because a lot of times you may find little bits of plant material that have been inhaled or grass awns that have migrated. So you can find causative agents, and I'm not talking about bacterial agents, but you can find causative agents sometimes in pulmonary abscesses. If you culture something like this, you're probably going to get Drupalella pyogenes, the great survivor, out of it. So it's nice. It's a eureka moment when you find something like this. So don't throw away the pus without examining it very closely. Lungworms. Sheep do get a number of different lungworms. Some that are pretty well host adapted and don't cause a whole lot of problem, and some that can cause problems. Only one that is very well host adapted results in these little gray nodules throughout all of the lung fields. And this is Mullerius capillaris. It has a snail or a slug intermediate host. And then the adult's larva and the eggs will live happily in alveoli throughout the lung. The greenish nodules are a combination of the eosinophilic inflammation that accompanies the granulomatous inflammation in these affected alveoli. And the nodule itself is largely just mechanical breakdown of alveolar walls when you have the whole happy family of the lungworms in there. Another great picture, which also, if you can sort of imagine this, if I can make that bigger, if you can imagine a greenish tinge to this. A wonderful picture by Dr. Helen Ackland of the University of Pennsylvania of a fairly severe case of Mullerius capillaris in a sheep. So the distribution is throughout the lung. Most of the other two significant lungworms of sheep and goats tend to affect primarily the caudal-dorsal lungs, especially over the large airways. This would be either Protostrongylus rufescens, which is about the same size as Mullerius, but just likes the airways. The adults will live in the airways, so you get your most profound lesion over the largest airways in the lungs, and these are those that supply the caudal-dorsal areas. Another one is the trichostrongyle, and the one that probably causes the most disease, especially in young lambs who will develop cough and secondary bronchopneumonias. This is Dictyocallis filaria. The adults also live within the airways. They cause a catarrhal bronchiolitis, and young animals with severe infections can have cough or pneumonia and significant ill thrift. We don't think of lungworms as causing tremendous problems, but in young sheep, Dictyocallis filaria can be a bad actor. And one of the things that you will see in animals affected with Dictyocallis are these sort of wedge-shaped greenish areas on the caudal parts of the lung. Here's a cross-section of one of those sort of infarcted, inflamed areas. We're going to finish up this particular lecture with two quick tumors. I've covered the major tumors, the enzootic nasal tumor and the pulmonary tumors associated with Yogsikhti, but it's a good time. This could just as easily go in the integument lecture, but a real problem in sunny and elevated areas of the world, including parts of New Zealand, but you can also see it here in the U.S. in the mountains as well, or squamous cell carcinoma. You can see this in light pigmented breeds, especially in lightly haired areas, such as around the nose, the ears, and around the vulva and perineum, especially in animals that are either mules or docked, to get all of that hair away from and redundant tissue away from the genitals to prevent infections back there, but it also exposes an area that's normally sort of protected from the sun to the rays of the sun, and they can develop damage to the DNA and by UV light and squamous cell carcinoma, just like light-faced cattle or horses or cats. And then this is a condition that is probably much more commonly seen in cattle, but mesothelioma, plural forms of mesothelioma, can be seen in sheep. You also can see it in the abdominal cavity, in the pericardium. And if this was a wild ruminant, like a deer in certain parts of the U.S., the upper Midwest, Michigan and Wisconsin, I would consider the possibility of Mycobacterium bovis, which sort of masquerades as mesothelioma with these pearlescent growths on the inside of the pleura. Something to be concerned about, not in our domestic species, but there are a lot of hunters up there who may encounter that. So that is something that you should be very careful with if you see it in a deer, especially in the northern Midwest of the U.S. And that brings us to the end of this particular lecture. I hope you enjoyed it as much as I enjoyed giving it. We're going to come back in our next lecture and talk about the urinary system of small ruminants, and I hope that you will join me for that one. Until then, I wish you good health, good luck, great happiness. Let's be safe during this pandemic. We're going to be entering a somewhat difficult time, and we're all going to get through it if we work together. So wear that mask. And I'll talk to you again.